Could the drugs you're taking every day put you at risk for dementia? Scientists have discovered a link between long-term use of anticholinergic drugs and dementia. In this video, we'll talk about the different types of medications and include some examples. It is estimated that over 600 drugs have anticholinergic properties. Studies show that taking anticholinergics can increase your risk for dementia by 6 to 45%, depending on the dose and duration of use. Researchers suggest that people who took anticholinergics for up to 90 total daily doses had a 6% risk of dementia, whereas those who took 1,095 daily doses had a much higher risk of 49%. Anticholinergic drugs are an old class of medications that are prescribed for a wide range of health conditions, ranging from depression to overactive bladder. Some anticholinergics have been shown to increase the risk of dementia by 49%. They are listed as antidepressants, antipsychotics, antiepileptics, antiparkinsonians, antihistamines containing diphenhydramine, and bladder antimuscarinics. These drugs block the action of a neurotransmitter in the brain, called acetylcholine. This neurotransmitter transmits messages from one nerve cell to another throughout the body. It plays a major role in memory, concentration, attention, and learning. It also regulates involuntary muscle movements. A 2018 study published by the British Medical Journal cautioned clinicians to avoid prescribing long-term use of anticholinergics to patients over the age of 55. Why? Because acetylcholine production in the body decreases with age. Moreover, one of the medical conditions associated with low acetylcholine levels is Alzheimer's disease. For this reason, it is important to refrain from taking this class of medications over a long period of time if you're a middle-aged individual. Some of you are probably taking more than one type of anticholinergics, not realizing that these drugs can shrink your brain and put you at greater risk for dementia. It is estimated that 1 out of every 3 medications prescribed to people over the age of 65 is an anticholinergic. This is quite alarming. According to research, some older adults with normal cognition have experienced episodes of frequent falls due to long-term use of medications with anticholinergic properties. The common side effects include blurred vision, dizziness, confusion, urinary retention, and disorientation. However, it is suggested that drug-induced cognitive impairment can be reversed once the drug therapy is discontinued. Now, let's go over some examples of anticholinergics that have the most significant risks for dementia, according to a 2019 study published in JAMA Internal Medicine. They are anticonvulsants, antihistamines containing diphenhydramine, antiparkinson's drugs, antidepressants, antivertigo, antipsychotics, and antimuscarinics for bladder control. 1. Older class of antidepressants: Elavil, Paxil, Doxepin, Tofranil, also used in children for bedwetting. If you're on any antidepressant, find out if it's anticholinergic. 2. Anticonvulsants: carbamazepine, Tegretol. 3. Antihistamines: Benadryl, Dimetapp, Vistaril. Medications containing diphenhydramine. They're usually taken for allergies, itching, hay fever, and the common cold. 4. Antipsychotics: Thorazine, Clozaril, Zyprexa, Seroquel. 5. Antiparkinson's: Benztropine, Cogentin. 6. Analgesics: Demerol, codeine, oxycodone, morphine, fentanyl. 7. Bronchodilators: Atrovent, Spiriva prescribed for COPD and asthma. 8. Overactive bladder: Detril, Vesicare, Ditropan. 9. Muscle relaxants: Flexeril, Roboxin. 10. Motion sickness: Antivert, Dramamine, Scopolamine. 11. Sleep aids: Unisom, NyQuil, and PM versions of OTC pain relief such as Tylenol PM and Advil PM. What to do? Familiarize yourself with every single medication you're currently taking to determine if it's anticholinergic. Do your research. Then, ask your doctor for a safer alternative. It's important to understand why you're being prescribed a certain type of medication and the risks involved. Always evaluate the efficacy and watch for unusual side effects. Avoid using any OTC drug long-term without researching it. Protect your health. There you have it. Remember to like and share. Thanks for watching.